I hired a doula when I was pregnant. I went through a prepared pregnancy course, and the woman who led it with her partner was also a doula. And I was like, I need to be prepared for this. So I hired her to be my birth doula. But I did not know that there were, women out there who served as fertility doulas until I started doing this work and building this community, and I was like, "Of course, there should be fertility doulas." Like, I wish that through my journey, through losses and trying to conceive before doing IVF, like, all the steps, there are full spectrum doulas that support women and families kind of going through all the different types of phases that someone can go in this journey. And so I thought it was just such an important discussion to bring to the Rhea community about what a fertility doula does, how they can support women to be their best advocates throughout the journey, and just kind of pull back the curtain on all the ways that a fertility doula can be supportive. So, with that, I'm excited to introduce Jessica Palmquist. She is a fertility doula out of Nova Scotia. So really just happy to host you, and I will let you take it away from here.
Thank you so much, Monica, for having me. And Caitlin, at any time, feel free to ask questions, come off the microphone. I share in a way that, if you have a question, it probably makes sense to ask that question in that moment rather than waiting until later. So feel free to ask questions and we can navigate some of this content together. So thank you so much. And anytime I have the chance to talk about fertility, I'm always eager to do that. So, as Monica shared, my name is Jessica Palmquist. My pronouns are she, her. I'm originally from Nova Scotia, and not long ago, our family moved to southeastern Ontario. So, I'm a little bit closer to many of you who are south of the border. I love to travel and be by the ocean. I've been to 34 countries now, traveling a little bit less since having kids, but definitely learned so many things along the way. I work as a full spectrum doula, so I do the fertility work and then the prenatal, birth, postpartum, and I also do infant and pregnancy loss support. And when I first started working with fertility, I realized you really do need to be full spectrum because if I'm supporting someone to get pregnant, then they probably want a birth doula too, and I can support them throughout the whole journey. And now I work as a mentor and educator and wellness provider. I have a outdoor yoga studio on my property, a very unique concept where we host yoga and wellness events 12 months out of the year and a place to gather and find community and connection in our rural region. We live south of Ottawa, in Ottawa, and I am an IVF mom. I have two boys that would not be here today if I had not gone through that journey with the fertility clinic. So, I'd like to share a little bit about my own fertility story with you just so that you can get a sense of, what I went through. I tried for almost 4 years to conceive naturally. I was doing the cycle charting, monitoring my cycle, doing the ovulation tests, like doing everything possible to try to conceive naturally, seeing all the holistic providers I could see, doing tons of education and informing ourselves, taking all the supplements we could take. And month after month, for whatever reason, it wasn't happening. And as many of you know, it takes so long to get answers with the medical system. We were on wait lists for many, many years. And it took me a long time to get any preliminary testing in Nova Scotia at the time. And my husband even decided to look out of Nova Scotia because when he was looking for a urologist, the wait time was nearly 3 years. And we were really trying to grow our family now, not in 3 years, but now. And so we were looking at, well, what could we do? And we realized that, oh, okay, if we connect with a urologist in Toronto, then the wait time is like a month. And so we were able to get in with a clinic in downtown Toronto and get some testing done for him to get some answers a lot sooner. Now we were in a privileged situation to be able to travel interprovincially and to be able to explore other clinics, but the the options within our own province were very, very limited. It took almost a year for me to get any type of results. And that was after waiting the typical 12 months of trying to conceive and then finding a provider. So now we're 2 years rather into the journey and trying to get some answers. And the answers were inconclusive. It was, you have a baseline fertility, you can get pregnant, we don't know why. And we were diagnosed with unexplained fertility. We tried different avenues, working with an acupuncturist for fertility, taking different types of supplements, different types of medications to try to induce um, the hope of getting that positive pregnancy test on the test, and unfortunately it didn't work. And then we were recommended to a fertility clinic. At the time, I didn't know that you could self-refer. So I was waiting for that referral from the gynecologist, which of course delayed things. We finally did get in with the clinic and we're told it's a 6 to 8 month, potentially up to 2 year wait with the fertility clinic, and there's only one in Nova Scotia. And when I looked at what's involved with IVF, I really didn't want to have to go to another province and have those extra costs of flights and hotels and being away from my support network. I really wanted to do it close to my home. And I would call the clinic almost every 3 months to be like, did you get any cancellations? And I feel like that really helped me move up on the list. And eventually they had said, like, yes, we can get you in. So I think I did wait around 6 months with the clinic, but I felt that, being proactive and not taking no or not yet as the answer and kept trying helped me get in a little bit quicker. When I met with the clinic, they had said, "You're really good candidates for IVF." And when I first started trying to conceive, IVF was off the table. It was something I was never gonna do. But month after month, year after year, and test after test, you start to realize that, okay, maybe this is the only way. And they were giving us really good prognosis saying, it's unexplained. So if we add this sort of very structured environment, we really think you're both good candidates for this procedure. So I took time off work and did everything I could do to reduce my stress. We were eating all whole foods and, taking all the supplements and meditating and getting out in nature, doing yoga, all the things, anything. If they recommended it, I've done it. And then went through the IVF process and was very lucky that after my first round of IVF, I was left with two embryos, and both of which resulted in two live births, which is pretty rare in IVF because we know there's a 50% attrition rate that, if you get 10 eggs at your egg retrieval, for example, that five maybe will be mature and then they'll fertilize five, but potentially two or three of them will become embryos. And then potentially after that, it reduces by 50% for them to reach that blastocyst phase at the 5 days when they typically do the transfer. So I was just, blown away by the fact that throughout this whole process that I did in fact end up with embryos that were viable for transfer, and then also that it worked both times. I had did the
That's
fresh transfer
incredible.
right after the first round of IVF and froze one. And then after my first was 14 months old, went ahead with the second transfer and it did work. And then through all of this and that difficult yet worth it journey, I realized there's got to be a better way. And then there is fertility doulas. So I studied to become a fertility doula, really want to support people through going through the clinic setting or trying to grow their family in the very different ways that people do. And it really inspired me to dive deep and share my journey because we know that fertility can be a bit taboo. Currently, more and more people are speaking out about fertility. Even when I went through this, 6, 7 years ago, it was still not as loud as it is now, where people are talking about sharing their stories on Instagram and TikTok and social media. And so the more we talk about it, the more we can reduce that stigma and let people know there's nothing wrong with you. This is a diagnosed medical condition that some people have when they deal with infertility or unexplained infertility. And there are things we can do to support you with your goal of growing your family, if that's something that you want to do. And so when we think of the word fertility, if you asked anyone off the street, and I've taught hundreds of students to become fertility doulas, if I ask them, when you think of the word fertility, they're going to tell you something different, all of them. Some are going to say pregnancy, birth, getting pregnant. And then for someone who's had a difficult journey, they're going to say trying to conceive, or they're going to say an investigation, ovulation, conception, managing maybe a condition that's preventing someone from getting pregnant. It could be reproductive health awareness and education. It could be assisted reproductive technology. And even within that one phrase, there's so many different things that a clinic can do to help someone conceive, whether it's a medicated cycle or artificial insemination. And then even within that term, there are different types of inseminations that the clinic can do depending on what the baseline fertility is for the individual. It could be IVF, or it could be people who are donating specimens, whether they're donating sperm or eggs or embryos that they're wanting to have adopted because maybe they were in surplus. It could be surrogacy, or it even could be adoption if they're beyond the clinic setting. And then with fertility comes also loss, and then pregnancy after loss. So the fertility spectrum is huge, and the interpretation of the word fertility is huge as well. And it starts when we're teenagers. It starts in preteen life, in elementary school, when they should be teaching people about their bodies, about their anatomy, about what are the body parts called, what do they do, how do you keep them healthy, how do you ensure you're creating an environment to sustain and maintain fertility, not just for conception, but also for functionality. And unfortunately, in many states and countries, the education is just not there within the school system. It's lacking. People are getting different versions of fertility education depending on, is it a really conservative school, or are they going to a religious school? Here in Ontario, half of the schools are Catholic schools, so the type of education that those children would get is very different than if they're going to the public school, for example. So we have now adults who are trying to get pregnant, who maybe don't know a lot about their body, or about how to get pregnant, or when to get pregnant, or when to time conception, or what days in the month can you get pregnant. And they're not at fault. It's that they were not prepared and were not educated in that way. So a fertility doula comes in and we can help you with all of that. So what is a fertility doula?
Hey,
Uh,
Jessica, sorry to interrupt. Are you sharing the slides that you have?
I am.
Okay, I'm not seeing them. I don't know, Caitlin, if you are.
Yeah, I can see them fine.
Okay, then it's just my
Okay, great. Okay, so a fertility doula is a person who provides emotional support, informational support, resources, and referrals to anyone on that spectrum I talked about. So it could be someone who's in the very, very beginning phases of wanting to conceive, and they're coming and saying, "I know nothing about trying to get pregnant. I'd like to get some information." It could be supporting someone with cycle charting. They've been trying to get pregnant for a while, and they now need someone who has a little bit more education to teach them how to chart themselves naturally for conception. Maybe it's someone beyond cycle charting and they want to work with someone who can support them at the clinic setting. So the majority of the people I work with are typically at the clinic setting. They've done the information phase where they've learned how to chart. They've charted themselves for many years, and then they were referred to a clinic. They're now working with a clinic, and then I'm supporting them with that whole huge new phase and chapter. We support people where they are. So wherever that person is, we meet them and we provide the education that they need, whether it's supporting them with maybe a reproductive health condition that they have, or a diagnosis that they have. Maybe they have to go through some testing or some procedures before they can move forward with trying to conceive. And we're helping them with giving them information on how to navigate that journey as well. And then many doulas will provide different types of support. So they might provide one-on-one support in person or virtually. They might provide group support, or sessions within communities, or providing webinars and things like that. And really, it's infinite in what we can do. I'm certified, so when you're looking for a match, you can look at, where did that person get their training? Is it based on experience, or did they take a course? And, what do they do for work and things like that. And so there's so many different things individuals can get certified in as well. And so you can look and see, well, does this fertility doula have specialization in certain areas? And some fertility doulas will tend to niche. So they might focus on just cycle charting, for example, or maybe preventing pregnancy. So there's tons of fertility educators out there that are teaching people about how to prevent pregnancy naturally without hormones and using charting. And then you have fertility doulas that do more full spectrum support, like myself, who've maybe gone through a more in-depth training where they cover a lot more topics and are focused more on helping people conceiving and then within the fertility setting as well. In terms of finding your match, a lot of the doula organizations and associations out there will list the doulas on their website, and then you can see if they have additional training in fertility. In
Mhm.
that way, Google search, Instagram, word of mouth, and talking to providers, but it is a pretty new thing. So sometimes it can be a little bit tricky to find a fertility doula, but going through a doula association first, because they'll definitely be able to connect you with someone who has that additional course, or if they don't know, they typically know people in the community who have the training and can make that referral.
Hey, Jessica, I have a question about fertility support in that initial stage when you're trying to conceive and just learning about your cycle. What have you seen are some of the, um, I guess, like aha moments that a lot of your clients that are just like struggling, trying to conceive, um, like what are the things that they're learning about their cycle, their body that you're starting to see as like common themes that like, wow, if people really did know this sooner,
Mhm.
that would be great, before you're like months, years down the road. Is there anything that
Yeah,
like pops out at
for
you?
sure. So a few of them are cervical mucus would be one theme that pops up where I'm teaching people about the different types of mucus that they'll have throughout their cycle in the month. And it tells us a different story. Like the different type of mucus that you have is for a different function. And then we talk about, well, what kind of mucus do we want to see
Mhm.
for fertility? And then if that person's like, I don't ever have any mucus or discharge, then we could say, we actually want to see that. So if we don't see it, here are some things we can do. Here are some people you should meet with and talk to. And then if they are seeing a discharge or mucus, then we talk about, this is good. This is, what we want to see. Because a lot of people think, I shouldn't have this or there's something wrong with me.
Yeah.
There was a student who I taught in our fertility doula program that had, when she was in her early 20s, she kept going to the doctor because she had this discharge, and this male doctor kept saying, "Oh, it's probably this," and was prescribing her a medication to correct that discharge when it was always normal mucus discharge.
Wow. Yeah.
So it's just that even our providers aren't specialized
Yeah.
necessarily. Um, Focusing on individuals who have internal organs and what those internal organs do and what normalcy looks like. And when you think of a GP, a general provider, a general
Mhm.
practitioner, they have a lot of knowledge about a lot of things. And sometimes fertility doulas have more knowledge in fertility than the GP would.
Yeah.
Like for that example, like why was he prescribing her like, an antibiotic, for example, when it was normal
That's
discharge?
crazy. Yeah, totally.
And so cervical mucus is one theme that comes up, that aha moment, like, oh my gosh,
Mhm.
when I get that egg white, that really sticky, goopy, like of the person would wipe and it kind of like flings up and maybe goes on their leg, for example. And like that's really good for helping the sperm swim and get to where they need to go. It helps it move. And people are like, wow, I didn't realize that something so simple has a purpose, and I just thought it was, the way my body worked, but I didn't know that it was useful.
Right, and how
Another
it's tied
thing.
to or tied to fertility
Yes.
and
Yeah.
yeah.
And then another thing is timing. So
Mhm.
the scare tactic type of, sexual education that teens get, like, don't have sex, you get pregnant, stays
Mhm.
with people in adulthood. And then when they're trying to conceive, they're trying to conceive every single day of the month and essentially depleting the sperm banks, which we don't really want you to do. Withholding a couple days is actually good to increase the number of sperm so that when someone is trying to conceive, the chances are higher because in one batch or one sample, so to speak, there's more of the sperm concentration. And so when I talk to clients, we say it's you can't get pregnant every month of the cycle. We're only really focusing on ovulation. So, and we want to optimize before you ovulate because when you ovulate, that egg will die in 24 hours. So you have just a very short window after you ovulate. So if you're not trying to optimize the time before you ovulate, that 3, 4, 5 days, because we know that sperm can live longer than 1 day. So we
Yeah.
optimize before ovulation. And it's like that aha moment, like, oh my gosh, really? Like we don't have to stress ourselves out to work it into our schedule 30 days out of the month. It's like, no, it's better to optimize around your fertility window, that 4 or 5 days before, and then the two up maximum of 2 days after. And then you can give your body a little bit of a break to recover, rejuvenate, and get ready for the next cycle. So timing, cervical mucus,
Yeah.
for sure, are
I think
two,
one of the sorry, go ahead.
no, the two aha
Those are
moments that
2
come up
big.
the most.
Yeah.
Yeah.
And as far as timing goes, I think what I have learned is that there's a lot of people who there's so many apps, right, for cycle tracking now, and it's like it's supposed to tell you when you ovulate, but a lot of the time, if that's what you're going on and you're not tracking your cervical mucus and you're not what I learned was about basal body temperature increasing,
Mhm.
like, confirm ovulation. I mean, I never knew that. No one taught me that.
Yeah.
I was struggling, and I
Yeah.
had to really understand how to track my cycle. Um, that it can actually do damage. Like it could take longer for you to get pregnant if you're just basing your, fertile window on
Yeah.
that calendar in the app if
Right.
you're not looking at the other factors.
Yeah, a lot of people will say, "I don't need a fertility doula because I have an app." And
Right.
so, the problem with the app, like you said, is it's predictive. Most are predictive, not all. There are some
Yeah.
fairly good apps, but you usually have to pay for those, and I caveat that with, you have to do other things, like add your temperature and add your
Right.
cervical mucus for it to be accurate. But most apps are predictive. So, you'll enter the day 1 of your cycle, and then it will go, "Oh, you have a 28-day cycle, so you're gonna ovulate on this day." And it's like, no, the majority of people do not have a 28-day cycle, which society says, "Oh, that's what you're supposed to have," but there's a huge range of normalcy. And so, like you said, it's a problem because people will go off this app thinking they're gonna ovulate, and they're misinformed and they're maybe trying or timing it around the wrong window. And then so I'll teach my clients how to chart without an app. So I teach them how to
Okay.
do it without I do manual charting, and we do basal body temperature, and we do cervical mucus, and I have a digital chart that they use that they're able to manually chart, and then they also chart other symptoms. So they'll chart their mood, they'll chart their stress, they'll chart the type of cervical mucus and how much, and then
Mhm.
anything else. So I individualize it for every client, which is so important when you want to chart. Like if you want to use an app, just make sure you can add things to it, like your basal body temperature, which is your waking temperature after before any movement in the morning, and your cervical mucus type and amount, and that you're able to put lifestyle things in, like medication, drugs, alcohol, prescriptions, all those things, because that will impact temperature and
Mhm.
cervical mucus, hydration, all those things. So when a client comes to see me and we're in the charting phase of teaching them how to figure out when they and if they ovulate, we'll do all of that. So we'll teach them about all things fertility, all things your body, and then how to chart manually, and then we'll talk about what's your lifestyle like? What other things do you think would be important to chart because it could impact your cycle, and then it's important to look for patterns. So after you're charting for at least 3 to 6 months to see patterns, you can notice that interesting. On the days that I do XYZ, my cycle does this, or my temperature does this, or my cervical mucus does this, so that maybe they can make adjustments if conception is the most important thing. Then yeah, sometimes clients may have to like give up marijuana for a short time or stop drinking alcohol if they're noticing it's impacting ovulation. And
Mhm.
if conception is the most important thing, and oftentimes when clients come to see me, they're ready to make those adjustments.
Yeah.
Yeah, great question. And then we're already talking about this naturally about why a fertility doula. We can do things more in a way that adapts it so much to that specific client that they're getting that customized care that they often can't get anywhere else. Like an app can't necessarily customize the way a fertility doula can, or even a provider can, because they see hundreds and thousands of patients. And a fertility doula is like your fertility best friend. They're answering all your questions. They're there for you. A lot of them will do text and email support, providing follow-up sessions post meetings.
Mhm.
So if we think about pre-treatment, that's sort of like that education that we do about, when do you ovulate? What does your fertility window look like? When should you be timing conception or trying to conceive? And all the tips for trying to conceive naturally would be what we call pre-treatment. And we go through all that, talking about lifestyle changes. I had one client who she and her partner would consume, and in Canada, marijuana is legal, so a lot of marijuana, and that when they reduce and significantly reduce the amount of marijuana they were using, her partner's sperm count went significantly up. So little things like lifestyle adjustments, supplementations. Now we can't prescribe anything, and I can't tell a client go and take COQ10 because it's really good for egg quality. But what I can say is COQ10, a supplement, is really good for egg quality. Talk to your doctor about if that supplement's right for you. So we
Mhm.
can make referrals and suggestions. We can provide them with articles and lists of optimal things that helps with their lifestyle. So we'll talk about lifestyle, we'll talk about adjustments, and we'll talk about education in the pre-treatment. And then if a client's then going through treatment, we can do things like meet with them after they've met with their clinic. And if you've ever been to a fertility clinic, the meetings are fast and it's blah, 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 and so much information. And then you're getting home and going, what did they say and what did that mean? They're using medical terminology. Sometimes they're meeting with the nurse practitioner and not actually the doctor. If you're
Mhm.
going through a cycle, you're seeing the nurses when you're going in the mornings for blood work and ultrasound and monitoring. And so what we can do is we can debrief after any type of medical appointments, even if they're in the beginning phases. They've met with a gynecologist or they've met with a specialist to go over maybe their condition or procedure they have coming up, and then we can talk to them about it. So if they're like, "What is an HSG?" We can say, "Oh, a hysterosalpingogram is, a procedure when a person blah blah blah." Like we
Yeah.
can tell them about what the procedure is, why they use it, how to make yourself more comfortable during the procedure, and how to prepare for the procedure, and really give them more of the information. The provider is going to say, okay, the first thing we're going to do is blood work, this, ultrasound, HSG, and then you're going to come in and we'll go over it. They don't necessarily go over all the steps of what do those tests look like? Why do you have to have them
Yeah.
done? Is there any pain involved? And how can you make yourself comfortable? Should you take time off work? All of those things a doula can walk a client through during treatment. We also can answer any questions that come up along the way. We can help clients to advocate for themselves when they're ready to go to an appointment. So oftentimes I will work with my clients on their list of questions that they're going to bring to the appointment. Like, here are things you should
Mhm.
ask, and create a list of questions, and then also helping clients advocate for themselves, because the clinic is going to do what the clinic needs to do for their own financial reason and for protocol reasons and just streamline. That doesn't always work for every client. So we help clients find the right clinic. Like maybe that clinic's just not going to work for them for whatever reason. and then we can give them information on, like, you're paying this client, the clinic rather, a lot of money to support you with your fertility, but it might not be the right clinic for you. And most fertility clinics are private, which means they can charge what they want. They're making money off of your infertility. So you want to make sure you're with the right clinic, that you feel like this clinic has my back. They have protocols that are supportive for me. They're really supportive in terms of patient care, informed consent, all of those things. And so as fertility doulas, we really help people with what should you look for when you're looking for a fertility clinic. And often most people have no idea because they've never had to deal with one before. And then post treatment would be after their treatment's done, maybe we're supporting them through, like, the 2-week wait when the anxiety's high. They just need
Mhm.
someone to work with them emotionally. For me, because I have the yoga and meditation certifications as well, I'll often do meditations with my clients, pre and post transfers, and work with them through the 2-week wait and trying to reduce stress and
Mhm.
just be present and, not to get ahead of yourself, because when someone's going through that journey, well, what if it doesn't work and what I'm going to do next? Am I going to have to do it again? And it's like, let's just take a deep breath and focus on the present.
I
So we
think that's
help
a very
people that way.
yeah, that's a very common, I think, anxiety that comes up within the community, whether you are in your cycle and just waiting to take that pregnancy test, or you are going through IVF and have that 2-week wait. It's like, what do I do to, not feel like all I'm waiting for is, the test result? And so having someone that is, like, there for you to be that sounding board to help you stay grounded is just so valuable, um, because you're not gonna get that from any other provider. My acupuncturist was actually amazing because I worked with one pre and post transfer, and I felt like we built that rapport where I could, like, kinda lean on her for some of that emotional support too. But yeah, it's just, I think that that's such an invaluable part of this.
Yeah, for sure. And I mean, we can tailor it. Some
Mhm,
clients, they do for their, like, mindset. They need to know, if this doesn't work, what's next? And so for some of my clients, we might be working through some of that, like
mhm,
options, like, do you want to take time off? And, like, if you take time off, what would that look like for you? Do you want to start again right away? Here are typically what clinics do, and I'll talk to them about, like, how many cycles they'd have to wait before they can typically try again. And then
mhm,
other clients, for their own mental health, they cannot just be jumping ahead, because then their body's in a state of stress, and that's not good. If you've just gone through a medical treatment and hoping that the embryo is going to implant, then we really have to work on those mindfulness practices, being present and distracted. So, one of the things I do is, like, putting my teacher hat on, is giving them homework or giving them tasks to do. So, I'll often get my clients to create a 2-week wait bucket list of all the things you're going to do on the 2-week wait that are going to keep you happy, healthy, balanced,
mhm,
and distracted. So, if it's a new art project or it's a new park or cafe that they're going to go explore, and I'm giving the couple or the individual, ways to live your life. And we talk about how it can be so easy to get swallowed up by the fertility world. And in a blink of an eye, 3 years could go by where you're consumed. So I talked to them about lifestyle, how when you're on the road to fertility, it doesn't mean you have to stop the road of life. They're synonymous. But if you stop one, then you're really missing out. And it's learning how to still live while also continuing on your goal, on your path.
mhm.
So that might mean having fun and doing things even through something really hard like fertility treatments. And
Yeah,
so some of it is just like lifestyle coaching, I guess, to you could call it, that we do along with the fertility education, but it's all customizable to the individual. And I'm always saying, what would be helpful for you, and
yeah.
what do you think you would like? And here are the things I could do for you, and what do you think would be best helpful? And kind of putting it that way.
That's great. Related, but also kind of tangent is um, sometimes treatments don't work, or um, you do get pregnant, but then you have a loss after, whether it's in the first trimester or after. Can you talk a little bit about just your overall support with loss? Because again, there is just it could happen when you're after, or when you've gotten pregnant after trying to conceive. It can happen after IVF was successful, but then not. So would love to just hear a little bit more about that.
Yeah, for sure. And that's why I went and got my infant pregnancy loss training, because with fertility, there's the potential that like it doesn't work. And for some people, loss is a failed transfer, and
Mm,
that's a huge loss for them. And I validate that, and I agree. And for some, it's an early miscarriage or a late term loss. So loss can happen. And so I like to be prepared to support my clients as much as I am very, very positive and uplifting with my clients. I'm also very realistic with them. So when we talk about like statistics, or we'll look at like the clinic stats, when they choose a clinic, we can get them. And then we look at, well, here's what this particular clinic stats are. Here's what your doctor's saying about your predicament, because it's individual for everyone. We talk about, there's a chance it might not work. And then even before they go through that, we'll talk about, in the event of loss, here are some steps we could take. So we're almost like preparing ourselves, not necessarily for the worst, because I'm very much the type of doula who's like, be present and be
mm,
positive, and your body listens to what you're telling it. That type of doula. I'm also very much like, here's the reality, unfortunately, of when we're dealing with treatments. And then when a loss does happen, when a client is in support with me, any package that they have is now diverted to loss support. And then we work through that in terms of, again, it's customizable, and every client wants and needs different things, but holding space for them, and then finding ways to memorialize. So depending on the gestation, they may want to memorialize or name the baby. They may want to create a memory box, so I'll help them with that. Then after the grieving phase, and then some clients will also want to retell. So if they had to go through a loss, or they had to go through a medicated loss, or
mm,
in hospital situation, or whether they passed it naturally, they may want to retell the story, because a lot of people within their support network are like, I've heard this story so many times, I'm kind of done hearing it from you. Like, so for
mhm.
me, being outside of their intimate circle, that's
Yeah.
my job. Like, I'm available to hear your story as many times as you need to share it. So it could be that way of moving through. And then after they've grieved, if they've reshared, we've memorialized, then the next phase would be the next action. So it would be the action steps of, do you want to take a break in cycle, or you want to try right again? And then we look at how that might work. And again, it depends on the type of loss, whether it was a failed transfer, or if it was an early miscarriage loss, or a pregnancy loss, or late term. It would depend on the clinic's protocols, and like how their body responded and how they healed and all of those things. But again, it's that education. So if the client had found out maybe at 12 weeks there was no heartbeat, then we would talk about, here are your options to go through your loss. Like, some clients don't even know
Mhm.
they have options.
Yeah.
The clinic might say, take this medication and go home. And I would say, you don't have to take the medication. You can pass naturally if you want. And then they can intervene later if for some reason your body did not pass it naturally. Like, we talk
Yeah.
about options so that they
Yeah.
have informed and can make informed decisions. We don't want to ever force or pressure someone into a certain situation. Sometimes clinics are like, they're just so used to protocol, like, oh, sorry, I had this loss. Okay, the next step is take this and then come back on your next day one. And it's like, what? Like, let's slow
Yeah.
down here and process this.
Yeah. My first miscarriage, because I had no idea what to expect, was very traumatic. And I think what I would want is everyone to like have that person. Like they don't know what they're about to go through. They don't know what their options are. And they don't know that a fertility doula exists. Like they don't know
Yeah.
that there is someone out there that could help them through those steps because the healthcare system is not designed to do that. So that's like one of my main goals is to like make it so well known and mainstream that like you might not even be thinking about getting pregnant, but you know that if you were and you ended up having a loss, that there are people out there who are trained to support you. I just think it's so, so important. There just isn't enough of a safety net, I guess I should say, when people are going through
Hmm.
such difficult situations in their fertility journey.
Yeah. Yeah, and if the fertility doula has training in loss, it's like the best
Yeah,
situation because we
totally.
can
Yeah.
support from all the journey. Now, if they didn't have the support, typically what they would do is they would refer to
Hmm.
someone who does. Now, I always make sure my clients, whether they're fertility clients or loss, have a counselor. That's the
Hmm.
first thing I ask, and that has to do with your support network, which is one of the next slides we're talking about is um, do you have a counselor? So that would be like really, really important. And then if the fertility doula didn't have experience or did not feel comfortable with loss, they would refer to someone who did, is typically what would happen. And then a lot of and most fertility doulas, they do this work because either they've been through it before or they're passionate because they know someone who's been through it. So most do have the
Yeah.
experience to support someone through a loss. And if not, they'll just make that referral and then we customize so much. So a lot of loss doulas will support someone through even an abortion. Like they'll go to the clinic with them and they'll do provide in-person support.
Hmm.
Or if someone's found out they've had a loss and they've decided they're going to do it has to happen in a hospital setting or it has to happen at home with medication, the fertility doula or loss doula could go with them to their home or to the hospital and be with them during. We can also tell them about what will happen
Hmm.
because a lot of people are prescribed a medication and told go home and they have no idea what's going to happen, and it is like you said, it's traumatic for them because they weren't informed. They didn't know I should have had somebody here with me. I didn't know, I was home alone and I didn't take time off work, and there's so many things that
Yeah.
people don't know when it comes to loss, and that it's a process, doesn't happen in 1 second. And so there's so much that we can do, and then we also help people build support networks. So whenever I have a new person come to work with me and I onboard them, I say, "Do you have people in your life who can support you? Like either emotionally, mentally, physically, and with information." And then I'll say, "Tell me about those people." And then we talk about how to choose a good support network because a lot of people do not know how. They're like, "Well, my best friend is my best friend, so they're my support
Yeah.
network." And then we'll say, "Well, your best friend has 4 children and you don't have any yet. And, do you find that's hard to always be sharing your journey?" And then the client might say, "Yeah, it's so hard. Sometimes I keep things from her because, she's got 4 kids and her mind's always on the kids." So we could say, maybe there's another person who could be a better support person for you. Not to say you're going to be any distanced from your best friend, but what you're doing with your best friend is best friend stuff. Like you're going shopping, you're going to go to the spa, and maybe who you're sharing your fertility journey with is somebody you met at the clinic who you see every morning for ultrasound and monitoring, and you introduce yourselves. And that's how I met one of my best friends, was that way
Yeah.
in a hospital, clinic setting. And, maybe they're the better supports. We talk about who should be a good support system. Some will say, well, my mom or my mother-in-law, because, well, they're my mom. But then maybe they're the ones that are saying insensitive things like, well, if you just went on vacation, you'd like get pregnant, or just like stop thinking about it and you'll get pregnant. Those aren't the people who are good support people. Right?
Yeah.
There are people who are going through it. There are people who can be unbiased. There are people who are good support people. And I teach people how to do that because most people don't know how to hand pick. And then I also say you don't have to have a lot. It could be your doula, your counselor, your health practitioners, because a lot of them are really great, like my acupuncturist is really good too, to be like, unload on me or how's it going, and to just be encouraging in that way. And then maybe 1 to 2 other people. It doesn't have to be 10 friends or 5 friends or every family member. And I
Yeah.
also say you don't have to share your story with everyone, because again, you're then living in that bubble of fertility where you still want to live life synonymously with that road.
Mhm.
So you don't have to tell everyone everything in it. Don't think of it as I'm keeping it from them. It's just it's on a need no basis. And you're going to tell them eventually, but maybe not when you're going through it, because it's that added like I have to tell that 10th person again that the transfer didn't work. And they're already devastated enough and have to retell that story over and over again, and every reaction's different. Like, the responses could be, "I'm so sorry you went through that, I'm here for you," which is what we wanna hear. But it
Yeah.
could also be like, "Well, at least you weren't later in your pregnancy and lost it," which is insensitive.
Yeah. Yeah, that's so true. I found, um, a in-person support group because I was in the tail end of COVID still when I decided, or I was thinking about going through IVF. It was a in-person meetup. Like, it was just women I had never met who I could sit in a circle and just, like, talk about what we're going through. It was,
Mhm.
like, so helpful to just be alongside those that are going through what, or can give you insight into what their experience was like.
Absolutely. So support groups, and a lot of clinics will have sometimes online support groups that are connected to the clinic, so you could connect with them. Sometimes being online is not a good thing. So for some
Yeah,
of my clients, I say get out of the groups, because you're seeing everyone's trauma dump, and then you're thinking because they went through a similar cycle as you that that's going to happen to you too,
right.
but your journey is your own. So when they're seeing things like people are posting, it didn't work, or I lost the baby in these groups. Sometimes when someone's in an active cycle, I often recommend just leave the
Right.
groups when you're in an
Yeah.
active cycle. And then
Mhm.
when you're in an information seeking cycle, you're in the group, because that's what the group is there for, to ask
Yeah.
questions, get answers. But when you're in an active cycle, your mindsets should be on your individual case study.
Yep. That's really smart.
Yeah. And then we talked about the support team, and then the other thing we talked a little bit about it already is advocating with the medical professionals. And so it's like what questions to ask, and then how to choose a good clinic. Some clinics are research institutions, and when they are, they'll often have some funding from the state or the province or the government. And when they are a research center, oftentimes they're a little bit cheaper. They're also sometimes a little bit more no frills, so there's not all the extra stuff that maybe a different clinic has, where they have all these amazing features and mineral water in the lobby, and, you can get a foot soak before treatment and things like that. But then, we can compare costs, we can compare experience, and then we can compare also, like, are they recommending things that aren't necessary? So as
Mhm.
a fertility doula, I talk about the reality of that fertility and infertility is a business. So the business of infertility, and how fertility clinics have a whole slew of services that they're going to sell, and sometimes they're not always required.
Mhm.
Clients sometimes feel obligated, like I should really get the embryo testing because, but
Mhm.
then as a doula who's unbiased can say, here are some scenarios when a person might want to utilize embryo testing.
Mhm.
Here's the reality of embryo testing. And so, yeah, it's a lot, because, it's easy to think you need all and every service, but you could do a more basic IVF, or there are some that even do like remote versions of it, or they call it mini IVF, where there's
Yeah.
less involved, that the person might not every person needs all the extra services depending on their health condition and their baseline like diagnosis. So we talk
Yeah.
about that as well. And like before making a decision, we can go through the benefits, the risks, and the costs and all weigh everything. And then they can make an informed decision about whether or not that treatment or that extra service that's being offered is recommended for them.
Mhm. Yeah,
Yeah, and
that's
I've seen
so
it all. So it's hard because clients think, well, because the clinic said I should do it, then maybe it increases my chances. And just because the service is recommended doesn't necessarily
right.
mean it's going to increase the chance of implantation.
Right. And a lot of the times people have like 1, maybe 2 options that are close to their home, and so you kind of feel like you're just along for the ride. I definitely felt that way, and I couldn't see like 2 or 3 steps ahead. I was like living in the moment because I just like couldn't take it on emotionally. And I just wish that someone was there to be like, "Listen, like, this is everything that they laid out. Like, let's just together walk through it a little bit more slowly and make sure you're ready for this." Because I just felt so overwhelmed making the decision and then, like, finally doing it. I was like,
Yeah.
it was so much.
I know. And yeah, and it's great to have a doula because they'll come and they'll say, I don't know what to do. I don't know. It's like too much. It's like
Right.
10,000 things. So we
So
can like,
much.
let's take a breath. First of all, let's take a breath.
Yeah.
And then we go through it step by step. And then I always tell my clients, you can get a second opinion. You don't have to go to with the clinic that's closest to you. It might not be the best. And then we talk about maybe the second opinion is a better fit because they maybe think you could have success on maybe a shorter cycle, a shorter or a mini version of, or not as many medications as recommended. So each clinic will recommend different protocols for individuals. And so
Right.
sometimes it's not a bad thing. And a
Yeah.
lot of clinics will do virtual consults. So to get a second opinion, you don't even have to leave your home before you decide if maybe you do want to travel, if travel is even an option. A
Yeah.
lot of local area hotels will do discounts if they know you're there for medical treatment. You just get a letter from the clinic. So I tell my clients all about the tips and tricks on
Mhm.
how to save money,
That's
if you're
awesome.
in an active cycle. And even a lot of people will host each other within their communities, within the clinic support group saying, hey, I'm coming for an active cycle. Would anybody be open to hosting me for one night for my consult or something?
That's awesome. Yeah.
And yeah, and I try to help my clients too with, you know, the financials of clinic support, whether it's looking at organizations that can help fund cycles,
Mhm.
or how do you raise money and how do you um, divert funds within
Yeah.
your regular life to the fertility fund? How do you make adjustments? What might you have to give up? And or what can you put on hold? And just giving people a separate and different perspective. A lot of times
Yeah.
they're like, we can't do it, we can't afford it. There's no way. But they're seeing what they see on maybe the website of the
Mhm.
clinic. And then you might say, well, you might not need all of these things that they're saying are fees. And there may be ways for you to find the money within your current means because you're not going to go to Starbucks every morning. You're going to make your coffee at home. Let's see how much that will save you per week. Things like just little things
Yeah.
like that. Or
Yeah.
maybe, you could look at the payment schedule for your mortgage, and some banks or mortgages allow for skip payments for medical purposes. And so we look at all of those things like without penalty due to medical reasons if you have a
Yeah.
note and things like that. So there are ways to try to mitigate that. So a doula will help with all of that too. And then um, really, after they have their meetings with their clinic, being able to debrief and then have those follow-up questions, because a lot of times clients are frozen during the meeting, and then after, "I should ask this and I should ask that,"
Mm.
and you can often email the clinic or the nurse practitioner, or you have a list when you go in for your next appointment.
Awesome. Thank you so much, Jessica. I know we're
Yeah.
pretty much at time, but Caitlin, I just wanted to open it up and see if you had any follow-up questions.
No, no questions top of mind. This is really helpful. Thank you for the time. Everything was really clear.
Thank
Awesome.
you. Awesome. Well, thanks so much for joining us. Thank you, Jessica. I will definitely follow up with you
Thank you so much.
after. Yeah, so grateful for you for sharing all that you do, such invaluable support. And yeah, just thank you so much for everything you do.
Yeah, and Monica has all of my contact information within the community
Yes.
if you have a question or concern.
Awesome. Thank
Awesome. Thank
you.
you so much.
Bye.
Bye.